I'm one of the thousands and thousands of people out there right now that don't have a GP for me. And I'm so glad to be here today to thank the doctors that are willing to say, hey, we want a real practice here.
So I am excited to see how the general practitioners of British Columbia have stepped forward with a GP for me to lead the charge in healthcare transformation.
What I'm excited about a GP for me is that we have an opportunity to bring our community together, the doctors, the health authority, community partners, to really get together and create a vision for what we want primary health care to be like in our community.
A GP for me is exciting because physicians get to have input into the way that they practice.
I see it as an opportunity for us to work together as a team with the health authority and the ministry and our local GPs to make something happen that is very worthwhile.
I'm really excited about this GP for Me initiative because one of the huge issues for us in the Northern Interior Rural Division is that we have recruitment and retention issues that are run very deep.
We were a prototype community in White Rock and had the opportunity to really take the first steps in the journey to try and increase attachment and to make primary care accessible to everyone who wants to have a family physician.
It has the potential, certainly, and I can see it in our community, of changing the way that we deliver health care.
Let's shake it up. Let's actually bring in all the different things we've talked about. Let's try it a bit differently in different areas. So what matches in one community won't necessarily match for another. And then we'll talk and compare.
What excites me about a GP for me is seeing all the different partners at all the different levels working together to problem solve and to really try to make a difference.
I am so excited about a GP for me because it means that I can be involved in an active way with another person for my own health.
I think for too long we've just reacted to problems. We fix people when they're sick. And really, I always tell patients that they're in charge of their health and really they're the ones who can do so much to keep themselves healthy.
I'm looking forward to creating systemic changes in our system so that we can serve patients better.
The thing that really excites me about GP for me is that it shows an opportunity for the physicians in the communities to really take a role in developing primary care for the community and for its specific needs.
I'm excited about GP for Me because it brings together doctors in their communities to improve healthcare close to their homes in a way that makes them feel more engaged in the healthcare system and improves the health outcomes for all British Columbians.
I'm very excited about a GP for Me. It has brought our community together.
I look to GP for Me for leveraging and facilitating the rationalization of our healthcare system and building a strong primary care system.
I'm excited about a GP for Me because of the legacy that it's going to leave for the people of British Columbia and in particular for the patients who really are looking to have access to that longitudinal coordinated care.
My vision and our division's vision for healthcare in the rural parts of BC involve a comprehensive primary care home with a team-based approach for patient services.
I'm excited that we're actually going to be proactive in anticipating the needs of all of these upcoming patients and doing our best to attach them.
I'm very excited about primary health care and the future of this because I think that's where we need to be. It's in the community, really focusing on a community-based system for health.
What's most exciting is watching physicians come together in their communities and taking such an active leadership role to support the needs of their entire community.
Well, it provides a real opportunity to make change in how primary care is delivered in my area.
I've been really pleased with the way that divisions have given family doctors the opportunity and the permission to come together.
With the First Nations Health Authority, I think there's a lot of great people here who want to learn more about the First Nations communities and want to learn more about their communities in their divisions.
What I've been really struck by is the excitement in the room. Excitement by the divisions, by the ministry staff, by the doctors of BC to really look at what are the issues in front of us around a GP for Me.
It makes me
at 88, feel like I've come into a new era.